Good evening. I'm X. I am a licensed clinical social worker. I have my office in northern Colorado. My schedule is 9 to 5 from Monday to Friday. So, quick question. Don't need to get into too many details. Have you had experience with psychotherapy or psychiatry before? Alright. Well, regardless of client experience, I like being able to set my foundation with my clients. So, my job is to be able to allow them to communicate freely without feeling judged and have them feel comfortable. Because I want them to talk and feel like they can be able to. Because talking can be really difficult with clients, especially those who are newer. So, I am pretty aware that we might not work. Some clients work better with other providers. And there's a bit of an issue with that. See, if perhaps your provider doesn't work and you keep switching around and you decide, well, this mental health care facility just doesn't really work for me, you're going to have a little bit of some difficulty with finding somewhere else. See, in Colorado, there are very few places that are even acknowledged in an official setting as a mental health care facility. And some of these places have multiple offices in several areas. Especially if, say, you live in the Longmont area of Colorado, where the two official mental health care facilities are both mental health partners. They're both. There's no one else officially recognized in that area. And the closest that you have would be, say, Boulder, which also has mental health partners, and maybe someone different. And going up north to, say, Fort Collins, you might have more variety, but you would have to go all the way to Fort Collins, which doesn't work with clients. Some clients don't want to have to drive all the way, if they can even drive. So, when we have this kind of issue where clients can't be able to meet with providers, be it physical availability in terms of the provider or the client, we run into a problem where these people suffer from poor mental health. I'm talking about clients who have low income housing. They can be disabled, or say that you're an inmate or from a nursing home. You just can't physically go to these places, whether it be because of physical barriers or schedules. So, this gets to be really serious. This costs not only people's mental health, put it bluntly, it costs people lives. Nationwide, gun-related suicides are about 67% of suicides. Colorado's percentage is 75 to 80%. That's massive. And this number is involved with mental health. So if this is such an important issue, and it really is, what can we do? And for that, I do have a suggestion, maybe even two. So, in specific counties like, say, Larimer or Boulder County, there have been measures taken to be able to allow taxes to be raised for this cause. So, we can be able to start having these funds for physical facilities and be able to allow more for clients. But that still doesn't solve the issue of what clients who can't make it physically can do. So, I propose that we allow the open option of telepsychiatry, which is just like FaceTime, but instead of talking with like family members or friends or business co-workers, what have you, it's through the practices of psychiatry, which is a business. So, putting that in to these measures and having it be an open option would really help clients. My suggestion with this is to talk to your county executive. Talk to your governor. Tell them that this is a serious issue. This is. There's no getting around it. And slowly we can be able to provide more for those who suffer from poor mental health. Which I think would be great. Well, I hope you were able to get something out of this time for yourself and maybe learn something. Maybe you'd like to be able to help, and I encourage it. So, thank you. It's a community that helps. Keep your community strong.